Hi, if you're a TN sufferer, trigeminal neuralgia sufferer, chronic pain sufferer, then I'm sure that this channel will be interesting for you. I'm in a situation where my pain condition is stable, but you can check out the whole of my channel and you'll see the whole journey. I've had this condition for about 3 years. I'm going to tell you about my experience of going back to the dentist. There's already a dentist video on there, but I went back to the dentist because the same filling keeps popping out on my trigeminal side, which is on my lower tooth right at the bottom. So I have to go back sort of about every 6 months and have it put in with minimal kind of intervention so that it doesn't flare up my trigeminal neuralgia. So I'm going to tell you about a well-meaning dentist who I feel like really challenged me. I want to say that first of all, I didn't enjoy the challenge and I felt he was well out of order. So I'm going to tell you what he said, but I'm also going to tell you something that maybe is an off-spin from that and how I might want to change my life a little bit. So I went in to a different dentist who was covering for mine, and the first thing I said is, I'm a trigeminal, sometimes I can't get the words out, I'm a trigeminal neuralgia sufferer. He said, oh yes, I know, I've looked at your notes. I said, oh, okay, so you know that I don't have drilling or anything, and this, yeah, I know. So then he went straight into, and how are you getting on with that? I said, well, yeah, I'm getting on okay. The medication stabilised it. I said, I'm on 1 tablet a day. I said, obviously it doesn't make me feel great, but I said it's stable. He said, oh, yeah. He was from a different nationality to me. Not that I have a problem with that, but I felt that he was someone who is probably goes a lot down the holistic experimental route with medication stuff. No problem with that, but this is my dentist appointment and we haven't even got on a chair yet. So he said, have you tried acupuncture? I'm like, well, no, I haven't. So again, I'm not against acupuncture. I'm sure there could be a chance that it might help me, but I don't know if you are a trigeminal neuralgia sufferer and you know what the pain's like along that trigeminal nerve. You are not going to go and have acupuncture done unless you know 100% that that person's well trained to deal with your condition and knows where to stick those needles. Yeah, well, over here in the UK, I don't know how I'm going to find that out. I'm not saying I couldn't look into it, but I just thought it was really odd to just come straight out with this in a dentist appointment. So anyway, I thought, here we go. Now, I'm sorry if you're one of these people that's been on my channel, but one thing I really don't like on my channel is when people make suggestions to other people or to me about what I can try for my pain relief, because I'm up until now anyway, I'm happy with where I'm at, but I'll explain later in the video what I'm thinking about, you know, where I am in my life at the moment. I don't like it because every trigeminal neuralgia sufferer and every chronic pain sufferer has a different experience, and some people are happy with going down, shall we say, a non-medical route, and some people aren't. Some people do really well on tegretol, which is what I'm on, or carbamazepine, and some people hate it. So you can't really turn around and go, do this and you'll be fine. You can't. And that's what I felt like he was doing. He was saying, have you tried acupuncture? As if to say, if you try acupuncture, all your problems will go away. That's how I felt he was saying it. And I really think that is almost minimizing what pain we go through and minimizing actually how hard it is to deal with this disease. So anyway, I said no, and I said I'm open to it, but blah blah blah. I got in a chair. I think he was trying to make me feel more relaxed, because I'm always nervous now at the dentist, where I never used to be a nervous dental patient at all, even though my teeth aren't brilliant. He started talking about the most bizarre things whilst I was in the chair. I couldn't answer him. I think he has a very dry sense of humour, but he was talking about all the people that he treated in the war-stricken zones for dental pain and what they'd gone through. And that seemed to progress into something else when I got out of the chair. He was talking about someone he knew nearby who'd had a limb amputated and was still feeling the pain of the amputated limb. He seemed to be suggesting that pain is psychological. All right, now, of course, there is a psychological aspect of pain. Of course, we can be in more pain when we're very stressed or when, you know, we're thinking more about it. There is ways of trying to block pain, but pain exists. and trigeminal neuralgia pain definitely exists. And I just thought, oh my goodness, I can see where he's going with this. He's almost thinking I can psyche myself out of this. So kind of thanked him for his time, but tried to get out the door quite quickly and just put it to one side and thought, yeah, okay, I've come across people like you before, but you haven't had it. You have not had this pain, so really, I don't really want to take on board what you're saying. However, okay, so this is kind of like a little bit of a turnaround here is where I'm going with this video a little bit. My husband and I had a conversation recently, shall we say it was a bit of a tiff, to be fair. We were talking about household responsibilities and how maybe sometimes I just dip out of life a little bit because, you know, and don't spend so much time around the kids and around him. And I can't remember what precipitated this, but I know he's right. Now you might be saying, well, you know, you're entitled to, you have trigeminal neuralgia. Yes, I think sometimes I am entitled to, especially when I'm in pain, but I think that I've got used to doing it now because I get tired quite quickly, so I have quite poor sleep as well, so I don't actually get up with the boys in the morning. They're teenagers, so they don't have to have me around in the morning, but Tim normally gets up with them in the morning, does the dog walk, gets them ready for school, because I find myself pretty drowsy in the morning. Now, I've almost got used to the fact that I don't do that role anymore, and I still want to do it. I still would like to go for the dog walk in the morning, still would like to see the boys in the morning, and actually by the time they come back from school I'm also struggling. I'm also not at my best, so it would be quite good to see them in the morning, because if they come home from school at 4 and I'm laying out on the bed and I'm a little bit not great, then they don't get the best of me then either. So, and also I've got used to letting him do a lot of the household chores, because when this trigeminal neuralgia was at its worst, I just could not do anything, and it was easier just to let him do everything because it was all too much effort. Okay, but I'm not in that place anymore. I can do more. So I'm not sure it was so much the dentist guy who made me think about this, or whether it's my husband making me think about this. But I'm thinking to myself, if I want to be more involved in the morning routine with the boys, I am going to have to probably come off of tegretol, because the impact of that one tablet, only that one tablet, is to make me more drowsy. And what happens is, so I can explain to you, this morning I got up, and the last few days I have, what happens is if I get up before my body really wants to let me get up with this medication, I find myself being quite spaced out, even slightly dizzy for the first couple of hours of the morning, and that's not a nice experience, I don't think. I feel like it's almost not worth it then, because then I'll get up with the boys and do what I'm doing, but then 2 hours later I'm on the bed thinking, oh my goodness, I feel so like, whoa, like the world is a weird place. So I think if I want to be part of that morning routine, and if I want to be more physically able to do stuff in the morning, I'm going to have to come off of tegretol. So this is a big question in my mind of balancing my life out. I'm not in remission because I do have bad days still, and if I do more, a lot more, whereas before it was like if I do a little bit more I need to stop. If I do a lot more, so my daughter's moving today and I'm going to be helping her sort of when she moves into the other house, so I probably will get problems tomorrow. If I do a lot more, or I'm really stressed, I will get pain. So I'm not in remission, but compared to how some of you probably are, if you're watching this and you're quite early in your journey and you think my life is over, I can't do anything, I can't drive, I can't, pretty much move out of my bedroom, I can't do household chores, I can't work. You might be in that situation. I'm not there now. This is 3 years on and I'm much more stable. So my big question is, do I try and come off of this medication? Do I cut down to half a tablet, because I'm on 200 milligrams of it, and do 100 milligrams before I go to bed, and then gradually wean myself off? It's a big decision, and the reason why it's a big decision is it worked, I'm stable, I'm much happier. Do I want to rock the boat? I don't know. I'll come back to you on it and I'll let you know, because I do want to do more around the house, and I do want to be able to kind of get up in the mornings a bit better, and the only way to do that is to come off that medication. So I'll let you know how I feel about it and what I do, whether I actually make that move or not. I'm going to discuss it with my husband. He'll go, no, don't do that, I didn't mean it. He'll feel really guilty, but I don't want him to, because it's a conversation that between the two of us I think needed to happen. My diagnosis was 3 years ago now, and things have changed, so maybe it's something that I need to look into. And also it's something I'm going to have to talk to the doctor about, the GP about, as to whether I could start coming off of it or not. And if they say no, obviously I won't, but if they say you can try it, then I might do. But the biggest problem around this is that once you're fully off of it, if you need to go on it again, the impact of going on that drug is massive. You literally fall around the room. Well, I did anyway. I couldn't basically stand up. It was just weird, really weird. And so that's my biggest reason why I've just kept going with the one tablet. So I hope you find that story interesting, even if you think that the dentist one is horrifying. Like, it definitely was horrifying. He did actually do a really good job on my filling, the best I've ever had. So don't want to go back and complain about him, because his dental work was really good. So subscribe if you're interested in trigeminal neuralgia or chronic pain. It is more about trigeminal neuralgia, which is a rare disease, but I do talk about things that kind of affect people with chronic pain. And I'll see you on my channel. Thank you.